The first year of a child's life is normally a non-stop daily or weekly celebration of firsts. First smile, first crawl, first steps, first words, first full night's sleep with any luck. But what if your baby doesn't seem to be reaching these milestones? Every child is different and meets these milestones at different times. So when should parents start wondering if something's going on? While every child develops at their own level, failing to reach certain milestones should raise red flags. Some parents recognize signs of autism spectrum disorder, or ASD, when their baby is around 6 to 12 months, and sometimes even earlier. In this video, we're going to talk about 7 early signs of autism in babies. Most of these would be likely to show up between the 6-month and 1-year range. Before that, many of these may not show up at all. And please remember, the information in this program is not meant to diagnose or treat. It should not take the place of consultation with a qualified healthcare professional. If your child is showing a number of these traits over a 6-month period, please see a doctor or speak with an early intervention agency in your area. Contact the nonprofit Global Partnership for Telehealth at gpth.org to get assistance online. Early diagnosis and treatment can really make a difference in helping your child get back on track. Now, here are the signs to watch out for. Number 1, no social smiling. Typically, a baby will reflexively smile back at you if you smile at them, starting as early as the first month, but certainly by the age of 3 months. As a test, you can try looking at your baby with a neutral face and then break into a wide smile that you hold for a few seconds. You can try 3 or 4 times. A typically developing infant should smile back most of the time. Number 2, lack of eye contact. Most babies are born with an innate interest in the human face, particularly their parents and family. Between 6 and 10 weeks, babies begin to direct their eyes more intentionally by looking directly at their caregiver and holding the gaze with eyes widening. At around 3 months, a baby will follow the movements of her caregiver as she moves around the room. Number 3, not responding to their name. Most infants will be responding to their names when you say it by 9 months at the latest. Number 4, no social anticipation or peekaboo. Typically developing children will lift their arms in anticipation of being picked up or start laughing or crying in anticipation of games like peekaboo. If your child seems not to be picking up on these traditional forms of play by 6 to 9 months, it is worth looking into. Number 5, poor visual tracking. Take a brightly colored toy and track it back and forth slowly in front of your baby. Does your child easily follow a brightly colored toy with their eyes, or do they seem to lose interest in it or disengage quickly? Number 6, lack of social babbling. Typically, babies love to practice babbling on the road to their first words. Babies with autism, however, may be slow and lacking verbal noise. They may be slow to verbalize or suddenly stop verbalizing after a certain point in time. Number 7, fixation on unusual objects. A symptom of autism in older babies is fixation or extended attention on unusual objects like fans, floor or ceiling patterns, or parts of toys, but not the toy itself. If your child is showing a number of these traits between the age of 6 and 12 months, please see a doctor or speak with an early intervention agency in your area immediately. Do not accept a wait-and-see approach. Many concerned parents are told, "Don't worry," or "Wait and see." But waiting is the worst thing that you can do. You risk losing valuable time at an age where your child has the best chance for improvement. And finally, trust your instincts as a parent. Ideally, your child's doctor or nurse will take your concerns seriously and perform a thorough evaluation for autism or other developmental delays. But sometimes, even well-meaning doctors miss red flags or underestimate problems. Listen to your gut. If it's telling you something is wrong with your child, be persistent. Schedule a follow-up appointment with a doctor or nurse, seek a second opinion, or ask for a referral to a child developmental specialist. And don't take no for an answer. You are your child's advocate. Early diagnosis and intervention are critical for children with autism. The earlier a diagnosis can be made, the earlier intervention methods, such as ABA therapy, can be implemented. If you suspect, don't wait. Have your infant evaluated as soon as possible during this critical period.